Hi, everybody. Welcome to BIA for You for Them, our podcast talking about issues that affect us all. And we have physician experts, physician leaders who take time and effort to come here and share their expertise with us and talk about it. It is my honor to welcome Dr. Britten Young. Dr. Britten Young is a general cardiologist who is passionate about preventive cardiology, lifestyle modification, medications, and it is my absolute pleasure to welcome here today to discuss with us not only about the modifiable or the changeable risk factors, the non-changeable risk factors, what we can do about it, but also she's going to dive a little bit into the American Heart Association's 8 essentials that we will learn about today. So, Dr. Young, what a pleasure to have you and can't wait to hear from you.
Hi, Nish, and thank you so much for having me today. I am just looking forward to this so much.
Thank you. So, Dr. Young, please start, if you want to start telling us a little bit about the modifiable, the changeable risk factors. What does that mean? What are the non-changeable risk factors for all of us?
Of course, I think it's super important when we are talking about reducing our risk for cardiovascular disease to know what the risk factors are for developing cardiovascular disease in our lifetimes, not just for us, but for our families, our children, our spouses, our brothers and sisters, and our friends. So knowing your numbers is very important. It is essential. And knowing these is even more important because all of the lifestyle interventions we're going to talk about today are all aimed at modifying these particular numbers. And they start with things that you've heard of before: blood pressure, body mass index, your cholesterol, your blood sugar, and other things like smoking status and sleep. When we go through these, Dr. Sareen, do you want me to go through each one of these and talk about which numbers might be normal and which might be cause for concern?
Absolutely, yes, Dr. Young.
Okay, wonderful. So let's start with blood pressure. So first of all, I would suggest when you're checking your blood pressure at home, you need to get a good blood pressure cuff. And you can find a list of these on a website called validatebp.org. It's free. You go on there, you can find a reliable cuff. Normal blood pressure is less than 120 over less than 80. And either one of those numbers, if it's above that goal, is abnormal. You don't necessarily treat right away if it's in the 120s to 130 range, but if it stays there over time and does not respond to risk factor modification and with lifestyle over a couple of months, and then you may need medication. So knowing where your blood pressure is at home, where you live all the time, as opposed to in your doctor's office or your dentist's office, where you might be more anxious, it's good to know those home numbers, and taking a list of those into your doctor every time you go is very helpful. So that's blood pressure. Body mass index, that's the next one. We know height, we know weight. Body mass index relates the two, and it will tell you, all right, is this a good weight for my height in general? It's not a perfect measure, nothing is, but we start with the body mass index to know if we might have a problem with how many pounds we weigh on our frame. A healthy body mass index is felt to be between 18.5 and 24.9, and that's a very wide range. So you may fall outside that range, but getting back into there is always a good thing to do. It is less accurate in patients who happen to be athletes with a lot of muscle mass. So when we are talking about those patients, getting your body composition tested, where you can actually measure fat and muscle separately, is a helpful thing to do. But that's just for a small segment of the population. For most of us, BMI is reasonable as a starting point. For LDL and the cholesterol values we need to know about, the most important one is LDL cholesterol. And those numbers, your personal goal value may be different than your neighbors based on the other things that you have going on with your health. But I look at it like, okay, in the general population, you want to see an LDL of less than 100. And that's a pretty aggressive goal. The numbers you'll see on the lab form that you get when you get your cholesterol checked are higher than that. So if I see it a little bit higher, that's at least something where you can look and say, hey, I think I can make improvements here. Another part of your cholesterol panel to keep an eye on is the triglyceride. And this is a different type of blood lipid that comes from eating a lot of sugars or simple carbohydrates in your diet. So simple carbohydrate intake could be lowered to lower triglyceride. Fat intake could be lowered to lower your LDL. And there's a lot of special things we'll talk about later with that too, but at least you know those numbers. LDL, again, less than 100 in general for most people, and triglyceride at least less than 150, and in a lot of people, I say less than 100. So depending on where you are in that range. If you're over 150, certainly we can make improvements. Modifiable risk factor is going to be blood sugar. So we have how we assess that. You have a simple blood sugar on your blood labs that you get. And we have something called an A1C, which is a 3-month estimate of your average blood sugar. And those are all lab values. So you'll find those out with your routine evaluation with your primary care physician. You want your A1C to be under 5.7% and your fasting blood sugar to be under 100. And then, of course, if you smoke, that's a modifiable risk factor. You shouldn't. You should stop. I count vaping in that category. And another one that's modifiable, which we haven't put a lot of focus on in the past, but more so as we've learned more about it, is the amount of sleep that you're getting. So a normal amount of sleep, a healthy amount, is between 7 to 9 hours. If you're getting less than 6 or more than 9, that's outside the range of what we would consider healthy on average. And Nish, I think we've talked a little bit about non-modifiable risk factors. Do you want to kind of lead into that?
Of course, Brit. No, thank you for all the modifiable risk factors, which are the ones that we can modify. Those are the ones that are environmentally dictated. And then there are non-modifiable, which could be, family history of heart disease, for instance, where there's nothing you can do about it, or the risk factors that you're born with, which are congenitally or which are genetically transmitted from one person to the other. And whether it is modifiable or non-modifiable risk factors, which means changeable or non-changeable risk factors, the fact of the matter is that heart disease or stroke does not happen because of one risk factor. And I'm sure Dr. Young has seen that in her practice as well, that it's an array of multiple things happening together. So whatever we can do to get that BMI in the normal range, get that glucose in the normal range, goes a long way to ensure that the non-modifiable risk factors are also taken care of. And for women, particularly, the non-modifiable would be, for instance, what's your age of menarche? When did the period start? What's the age of menopause? Did you have to undergo hysterectomy? Did you have eclampsia, preeclampsia during pregnancy? Which, in a way, we are at higher risk if we have underlying modifiable risk factors as well. So thank you, Dr. Young. That was a phenomenal overview. Really, very, very well done. I could not have imagined anybody else do it more beautifully, more eloquently, and more gracefully. Things that we ignore every day that are so important and can be critical in a long, healthy life, which is the ultimate goal for every single one of us. Thank you for taking the time to be here today. Thank you for sharing your expertise. If you have any questions, our listeners, please email us on beyourselfcontact@gmail.com. If you have suggestions for the next podcast, please let us know. I can already sense that we'll probably have to bring Dr. Britten Young back. So thank you for your time. Thank you. It is always a pleasure talking to you, Dr. Young.
Just a delight to be here talking with you about these things. I'm very passionate about them. I could talk about them for hours. I would be delighted to do it again. Thank you so much, Dr. Sareen. I appreciate it.